Welcome to another episode of What is Hashimoto's with Dr. Martin Rutherford. To find out more on any of our topics, or for information on scheduling a consultation with Dr. Rutherford, please visit us at whatishashimotos.com. And now, here's Dr. Rutherford.
So we're going to talk about treating symptoms versus treating Hashimoto's. And this is what most people coming in here are experiencing now. And the day when I started this, people came in, they had no clue. 15 years ago or whatever it was. People would come in, I'd say, Hashimoto's, they'd say, what's that? We talk about how it's an autoimmune problem. They tell me the doctor said that we're crazy. And you know, we talked about diet, and they're like, how could diet affect my thyroid and all that type of stuff. Today, it's not like that. Today, people are much more savvy, people are coming in, they've been on all the diets. They're a lot of times they're taking all the right supplements, but it's not working, and you can watch all my other videos to understand why it's not working for those particular people when it's not working, okay? One of the things that I see a lot now is doctors are not kicking people to the side of the curve and saying, oh, you know, Hashimoto's doesn't exist, or you don't have it. You have it. But medical doctors and even functional medicine doctors are practicing what I call a linear Hashimoto's protocol. I saw one yesterday. Just what I said. They haven't figured out their food sensitivities yet, but they're frankly taking all of the right supplements, or all supplements that could be right. Okay, they're taking the anti-inflammatories, they're taking the turmerics, they're taking the seleniums, they're taking the myoinositols, they're taking the magnesium. Yet they're still here, and they're still having all the problems. So when you've gone to a functional medicine practitioner who's doing that, they're practicing a linear attack on there. And those practitioners also have given you some for your stress, and they've given you something maybe for your bowels, and they've given you something for this. That's treating symptoms. It's more prevalent with the medical doctors. Basically what happens in the medical community is you go to the doctor and you have 20 symptoms, and they finally figure out that you have Hashimoto's. But they really don't get the full parameters of how you treat Hashimoto's. They don't. For example, I got this right here. This is what we call the web of Hashimoto's. So there's like 39 different triggers for Hashimoto's. Okay, they're all on this page, and some of them are groups and some of them are not. And some of you are trying to write all this stuff down. and so right away you have to look at those and go, okay, which one of those parameters are involved for that person versus the next person versus the next person. This is the way that the mature, at this point in time, functional medicine practitioner is going to attack a case of Hashimoto's by looking at all of these potential triggers and figuring out which ones are the ones for this particular person. Is this person on both birth control pills? Is this person not on birth control pills? Is this person have a viral infection? Do they not have a viral infection? And so on and so forth. What the medical community does is they'll look at your thyroid now, and now the thyroid for them is, okay, let's give you a medication, let's take a biopsy, let's see if the biopsy is cancer, if the biopsy is not cancer, or if you have a goiter you have a goiter, or if you have a goiter that's growing and it's shrinking, then let's take it out, and or let's not take it out, and let's just give you the medication. And then what they do is they treat all your symptoms with other drugs. This person comes in here on 5, 8, 10, 12 drugs. So you've got a drug for your anxiety that's being caused by your Hashimoto's. You got a drug for your constipation, which is being caused by your Hashimoto's. You got a drug for your neuropathy, which might be being caused by your Hashimoto's. And so on and so forth. You got a drug for your depression, you got a drug for your acid indigestion, and so you come in here, and that's clearly what the doctors are doing. We call that a linear approach to Hashimoto's. That is a very immature approach to Hashimoto's, meaning, okay, we'll just treat all the symptoms. And there's a lot of functional medicine practitioners. I know a lot of functional medicine practitioners watch this, so stop throwing tomatoes at the screen there, because you know it. You know what I'm saying is true. There's a lot of functional medicine practitioners. They miss the diet. They miss getting the food sensitivities, or they just gather all this data, and then you get a supplement for every one of those things. This person comes in with 2 bags of supplements, and And I just go like, don't even show me something that's not the way you go about this. And so you have that, you have that aspect of just treating the symptoms as far as that goes. And so this is what I mean by treating the symptoms of Hashimoto's. And you also have the alternative medical doctor that also kind of practices in that linear function. In their world, they're the ones the patient comes in to me with a stack of these specialty tests. There are a zillion specialty tests out there. They're all really expensive. Now there's more and more out there that are kind of credible, because there are companies that are kind of figuring out what the credible company's done, and they're making ones that competing and stuff. But there are only so many really credible tests out there. And then what the doctors do is they do all these tests. Maybe they got a theory on heavy metals being the whole problem. Maybe they test you for heavy metals. And the next thing you know, you gather this, they do tests on every single nutrient in your body. And then your arginine is low, and your ratio here is low, and that's low, and this is low. And then you get something for every one of those things. That is not the way you treat Hashimoto's. That is, again, that's very linear. It's very much, okay, I'm going to treat by the test. I got all these tests. It says that. We give you this for that, that for this, this for this. That is a recipe for a disaster. Most of you who've been through this know that. You know that you've done it. Some of the things made you feel a little bit better, but overall that didn't work for you. So when I'm talking about treating symptoms, I'm talking about those three models. The medical model that gives you a drug for every one of your symptoms. That's Hashimoto's. That could be fixed by getting the immune system dampened against your thyroid. I'm talking about the functional medicine practitioner who does the same thing with nutrients, and I'm talking about the alternative medical doctor who you come out with a stack of testing. There's something for every test, whether it's a shot, whether it's a chelation, whether it's a Myers cocktail. And I'm not saying none of those things are not effective in certain things, but this is not the approach. This is basically treating symptoms. Or I should add in there, but I don't think most people would have known what I was saying if I put that in the heading, are treating by the test. Okay, and you need testing. You need to figure out what's wrong. You need to figure out what that person's specific work is, but you need it for that. You don't need it and go, okay, you got these like 9 things. Let's give you something for every one of those 9 things. You need to look at everything and say, this is a picture for this patient. And this is, okay, and this is where we start. Okay, we're going to start with food sensitivities, and we're going to start with figuring out the diet, and we're going to figure out your blood sugar, and we're going to figure your blood sugar. Maybe that's what's right for that particular person. And all of a sudden you do that, and all of a sudden like 70% of our symptoms go away. And now you look at the symptoms that are remaining, and you go, okay, this is what's left on their particular pattern. Let's go after this next. That's functional medicine. That's how it's supposed to be done. It's efficient. And frankly, it's really the only way to go about it that has a chance of being consistently successful. So I think that's it. I think that's all I need to get out on that main points. I think that should give you an understanding of how to maybe assess the type of treatment that you're getting, or maybe assess the type of treatment you're giving yourself off of Dr. Google. On top of it, we might put you in the functional medicine practitioner area of like, I read Google, I did all of these things and it didn't work. So I think that works. So that is Hashimoto's and treating the symptoms. All right, that's it. Take care.
Thank you for joining us for another episode of What is Hashimoto's? To find out more on any of our topics, or for information on scheduling a consultation with Dr. Rutherford, please visit us at whatishashimotos.com.